Hi, and welcome to PHRC. My name is Danae Narvaza, and I am a pelvic floor physical therapist at Pelvic Health and Rehabilitation Center. So, you might be interested in becoming a clinical specialist here at PHRC. So, I'm here to tell you a little bit about my experience. Regardless of if you are a new grad, a well seasoned veteran in the pelvic health specialty, or maybe you are an experienced physical therapist or occupational therapist who now wants to dive into the realm of pelvic floor. Whether your needs are building your repertoire of treatments for pelvic health or if it's just refining your skills, PHRC has your back. So, what to expect during the training process at PHRC? So, when I first started at PHRC, I did have some pelvic health experience from another clinic, hospital setting. However, what's great is that they'll cater your training program specifically to you. So, the baseline of the training is they have a library filled with differential diagnosis, treatment plans, what to expect for different systems of pelvic health. So, that includes urinary, bowel, sexual dysfunction, as well as pelvic pain, which we see a lot. Within those videos, there is also some case studies for you to look through and even come up with questions that you may have, because throughout this didactic portion, you will also be able to communicate with the different mentors throughout PHRC, as well as the co-founders, Liz and Steph, and pick their brains a bit with any concerns or questions that you have. For me, what that looked like with the multiple clinics that we do have was I was able to jump onto a Google Meet video call with each of the mentors, and following watching a certain portion of the didactic program, think of it like a clinical residency, I had the opportunity to chat with individual clinicians who had different specialties or areas of interest. So, for example, some mentors really like working with the peripartum population, some with the endometriosis population, some with bowel dysfunction. It all depends, but everyone here at PHRC has a little clinical nugget to share with you. So we really are a plethora of knowledge. Another great thing to expect within your onboarding process is the hands-on training that you get. So we get a lot of pro bono patients who come in and volunteer to help you refine your hands-on and manual skills. Additionally, depending on the clinic that you are at, the clinicians there will also help guide you through practicing on them or on each other, which is great because you will need all the practice that you can get. Also, depending on your location, you can also observe the physical therapist or occupational therapist nearby you. So, for example, I'm located in Encinitas, so I had the opportunity to have an education vacation, as I call it, to both Encinitas and the West Los Angeles location. So I was able to learn from and observe a good amount of physical therapists within PHRC. So, luckily for all of us, the education and learning does not stop after that onboarding process. At PHRC, we value evidence based practice and staying up to date with the recent research. So, you are always going to be learning. It is an ongoing learning process. Some things to expect for the ongoing mentorship is we have regular meetings. So, there are mentorship groups that happen weekly. This is where you will be able to do case discussions. And then when you start to get comfortable with your caseload, or maybe you feel like you don't need as much mentorship, you'd always wean off those weekly extra mentorship groups. There is also the clinical groups. So, with the clinical groups, similar thing, you're assigned to a mentor and you are in a group with other PTs or OTs. And that is where you can also ask questions about any complex cases that you have, or listen to any other cases that other clinicians have to talk about, and pick each other's brains on how to tackle a specific case. And this happens every first and third Wednesday. Then we have our staff meetings. So our staff meetings are also on Wednesdays. This is when everyone, despite whatever clinic you're at, East Coast or West Coast, we all gather together, and it ranges from either a guest lecture coming in, maybe Liz or Steph will have a presentation, or one of the mentors will present a case study or do a book club where essentially they review a book and give you kind of the summarized synopsis of that book and whether they recommend it to you or if you should recommend it to your patients. This also includes literature review. So, any new literature that is out about pelvic health, sometimes we will have a mentor review that and give you the little tidbits and clinical pearls from that and how we can apply it in the clinic. Then we have our EDM meetings. So for this is where we can touch base regularly on our retention and productivity, what we can do better as clinicians to better retain and keep our productivity up. Also, this includes discussion of cases that you might need if the time permits. So, a lot of opportunities for growth and guidance. So, despite being on different locations that we have, you are never alone and you always have guidance should you need it.